Intraventricular hemorrhage in neonates is most common in premature infants or those that have a very low birth weight. In preterm infants, the most common site of bleeding is the germinal matrix. And this is a very highly vascularized region of the brain that is critical during development. However, in term infants, bleeding usually originates from the choroid plexus, which makes sense as you can see it's positioned right there in the ventricles. The choroid plexus is highly vascularized. It is where arterial blood is filtered into the CSF or cerebrospinal fluid. It then goes on to flow through the ventricular system. There are 4 grades of hemorrhage, and these have some clinical implications. With grade 1 bleeding, bleeds are limited to the germinal matrix, while grade 2 bleeds occur in the ventricle but they are not enlarged. Grade 3 bleeds are classified by enlargement of the ventricles, while grade 4 bleeds extend into the surrounding brain parenchyma. Now, it is quite obvious that grades 3 and 4 are the ones that are most likely to cause long-term brain injury. The presenting signs and symptoms are usually nonspecific and include altered consciousness, a bulging fontanelle, which is usually indicative of high intracranial pressure, or intracranial hypotension. Now, how would you try to treat this? So there isn't actually really a great treatment. Usually we will try to keep the infant stable and potentially drain fluid with either a shunt or a lumbar puncture. And if there's a concern, especially for intracranial pressure, then we'd want to basically address it with one of those 2 methods.